Hi everyone, Ali here, physio, with another video. Remember last video we were talking about the case study, lateral pain outer side of the hip. So today we're going to talk about pain front side of the hip or anterior side of the hip. So we had a patient, a gentleman in his mid-20s, playing football, and he said while he's playing football he's got problem around his growing area, catching, touching or pinching sort of pain, but it is only when he moves. But when he is in rest, there is no pain, no other activities causing pain, but only when he twists his hip inward or when he kick ball he start having pain, and it's a sharp shooting pain. He says when he walked to our clinic, I've assessed him, his gait. He was fit gentleman, playing football, so wasn't had any major issues with the gait. Muscular side, very strong muscles of his quadriceps, glutes, and there wasn't any obvious signs of the problems. When I examined his range of movement, so internal rotation of his hip, when I internally rotate his hip, he said there is a pain, there is a catching. When I adduct his hip or leg, then he had a pain. So when I did Federa test, he had a pain. That was a provocative. Also, Scott's, bit of uncomfortable in Scott's sitting and Scott's doing Scott's as well. So that makes me thinking of that this person has FAI, which is femoroacetabular impingement. There are different causes of hip pain. Hip pain, anterior side, could be due to tendinitis, due to tightness in adductor muscles. So as a physio, we have to see the patient's age, how the patients look like, what is the patient's daily activities, what patient comes with. In this case, patient hasn't had any fall, hasn't had any accident, hasn't had any other condition. He's a young, fit person, has only pain when he plays football. So the Federa test provoked that pain. So hence I concluded that it is FAI. Luckily we have got ultrasound machine. I did examine his hip and couldn't see very good fit anatomy. We couldn't see any obvious pathology there. So we started doing some treatment. Okay, before jumping on treatment, I have to tell you there are three kind of FAI, femoroacetabular impingement. One is pincer, which in that case so remember the hip joint is ball and socket. The socket is acetabulum. So on the top of the socket we have got cartilage, which helps keeping femur inside. So the cartilage sometime will grow and touch the head of femur or neck of femur, and hence when you catching that cartilage, that causes pain around here, and that's impingement due to acetabulum abnormality, which we call it pincer. The second one is CAM. In CAM usually occurs with the male population, but can happen to the female as well. So the head of femur gets some irregularities or osteophytes. As a result, the acetabulum, the cartilage around the acetabulum start touching, and also the head of femur, if I could show you here, head of femur gets irregularities and osteophytes and sharpness around here. As a result, when it moves inside the acetabulum, it causes pain and pinching. That usually, or majority of time, the statistics says male population affectee with the cam impingement, but the pincer is more relatively prominent in females. But the third is mixed, which is both, like acetabulum and head of femur, both has problems. So the mixed impingement is more prevalent and popular, and there are more cases of that. So that's very technical for physios to understand. But as a patient, if you feel that you have something is catching while you're twisting your leg inward, especially, or while you're sitting on a floor, or sometime when you're crossing your leg like a 4 position and it's catching your hip or growing area, you need to consult with the physio. The physios here, physios can help you. Physios trained with anatomy, and so if you live in Birmingham area, we are here to help you at Birmingham Physiocare with experienced team here to help you. So please do contact us if you or any of your family member has a problem. Thanks for watching.